record. Hello, so we are group 4 from Nursing 665, and we are working on our project. We decided that we would talk about the dilemma encountered when you have siblings that have health issues. In particular, we've got an invented patient named Rose, who's 14, who has the acute myeloid leukemia. She has a younger sister named Sarah, who's 7, and her parents have determined that they would like to see if she's a match and be a donor for her sister. So on that, we'll go ahead and continue on.
Okay. Organ transplant is becoming an integral part of modern medicine. It is a form of treatment that is saving lives and improving the quality of life for people, including children. Our discussion today will focus on ethical dilemma of having Sarah, a 7-year-old girl, donate bone marrow to Rose, a 14-year-old sister who is diagnosed with acute myeloid leukemia. Acute myeloid leukemia is a form of cancer, and it occurs when the bone marrow begins to make blood cells that has not yet completely matured. 50 years ago, AML was seen to be incurable. Today, with advancements in medicine and technology, patients 60 years or younger with AML have a 35 to 40% cure rate, whilst patients older than 60 years have about 5 to 15% chances of being cured. So I'll hand over to Shalina to continue from where I left off.
Perfect.
Thank you.
So when it comes to consenting children for this procedure, it's important that a donor advocate is assigned to the donor. And this is a safeguard that protects the donor against any ethical dilemmas that may occur in the situation. And the donor advocate is there for the donor and also kind of helps the parents understand what's involved with the process. And typically the donor advocate has training in child development, child psychology. They have skills with communicating with children, and they understand children's nonverbal communication, which is important to determine if the child is appropriate.
Sure, and well, because the parents might be missing the cues because they're so focused on the older sibling that they're not paying attention to the other subtle changes in their other child.
Correct. And and it's not to blame the parents, but that happens. It happens, and it's unintentional a lot of times. So this is why the donor advocate is there to kind of help make sure those things are being acknowledged and make sure the child's appropriate for the donor to be a donor.
I think, so you just mentioned, and Sarah in this case has to be consented, like asked to give a consent. So, but she is still 7 years old, so she's not matured enough to decide on issues which is very complex for her to understand. So what are we going to do in this case? So it's an ethical dilemma still. In traditional medicine, parents has to give consent on behalf of their children, and I'm sure in this case also Sarah's parents will just say yes, so she can give. So that's a problem on her behalf because she probably emotionally influenced her to do so. And that's why those professionals comes in practice to help the donor, and then physicians also get an assent in this case.
Yeah, because children aren't always autonomous, so they can't always make appropriate decisions. They can't consent. Sometimes they can't weigh the risk and benefits of
and not only the physical risk, right? So physically they could be at risk for infection. There could be nerve damage, tissue damage because of the bone marrow aspiration. There could be death. There could be issues with general anesthesia, certainly, and as well there could be the the psychological traumas that they're not even thinking about. They're thinking,
Right.
oh my gosh, big needle, I'm very scared.
Right.
But they're not thinking how stressful that's going to be and how it can impact them years down the road. Anytime that they're introduced to healthcare scenarios, this may be something that they end up revisiting.
Yeah, actually, the psychological impact is very, very important. You know, today it might seem okay, like you said, they will go to a physician's office, they see a needle, that memory can come back.
Absolutely.
So
Right,
we
but-
need to be careful.
Like, opposite to that, sometimes it's also had a very good impact on the relationship on the families. So she would be considered as a valuable, like, family member that she gave herself to her sister's survival. And for sure we can say her sister is alive today because of her donation. I know there will be a lot of risks on that. That's a part of our job and part of like a medical profession. But still, there is also like a positive impact on her. I mean,
Donating
you can say
the
donating
bone
Yeah.
marrow.
bone
yes,
marrow
yes.
to her sister, and that bond on among sisters will enhance on you see on the other side of
Yeah,
the
yeah. I think that's very, very important because the Rose, the 7-year-old, the 7-year-old, that Sarah, will feel better. That maybe she will be thinking, oh, because of me donating the bone marrow, my sister is alive today, and that's also very important. And it's very positive. So
Yeah, and
That's
Rosa also will acknowledge that because of Sarah, she just survived
Right.
today. And
you're right.
It does make I think when everything works out for the best, I think it does strengthen the bond. I
Yes.
think it's a lot
Yes.
stronger.
I hate to
Yeah.
be Miss Mary Rainflower, but it doesn't always work out for the best. And when that happens, then of course we need to pull in the social services, and we need to be able to pull in the resources for the emotional counseling that's going to be necessary should that happen.
Right.
Because even with all the best intentions,
Right.
things don't always work out the way that we want. So
Right.
that perspective needs to be taken into consideration too, because she certainly doesn't have that broad knowledge of,
understanding this complex situation.
Absolutely not. And her parents may not even, they're just holding on to the hope that this is going to make their other child better.
Right.
But, Rose may not recover, in which case then Sarah is left feeling horrible,
It's
maybe
true.
even pain
Yeah.
residual from the procedure. And her parents will be at a loss because they'll be missing that other child.
Yeah.
So,
And so, I think it's important just to, to remember that beneficence or acting in the child's best interest is always, the primary focus in these situations. And I know there's certain criteria that need to be met before a child is, able to go through the process of being a donor. And, having a strong relationship between siblings is one of those.
I think those 5 things I can just
Right.
mention it
Yeah.
from
Mhm.
here.
Sure.
So the American Academy of Pediatrics Committee on Bioethics deems to use a child bone marrow donor ethically appropriate when 5 conditions are met, and those conditions are the first one: no adult mites are available to donate the child's needing to transplant, and second one, the bone marrow transplant must confer reasonable benefit to the recipient. And third, the strong personal relationship exists between the donor and the recipient. And fourth, condition required is considering the risk and benefit, which is what you say, like the benefit and not harming the patient. And the fifth condition is consent and the patient's assent, which in this case, Sarah hopefully will do.
And the donor advocate is very important in the part where the patient assent aspect of this. That's where the donor advocate kind of comes in and makes sure that the patient understands, and make sure that the information is presented to the patient in an understandable, developmental, appropriate manner.
right, because when
that
they
can-
go to stick a swab in her mouth to do the buccal swab, they're going to need to explain that to her in a way
Right.
that she understands, either
Correct.
using puppetry or images or models or toys or dolls, whatever it is,
Exactly.
or maybe even bringing in other patients that have done this for their siblings,
Right.
if they can do that. And once that buccal swab comes back, and if they find that she is an HLA histocompatible match for her sister, then they need to go ahead and draw blood, which of course involves needles.
Right.
And they need to do a viral screening. They need to do education about that whole donation process, and do a physical examination. And hopefully all of those things will fall into place for the older sister's benefit. But if for some reason they don't, then she would no longer be a candidate. So I know the physician that is taking care of Sarah, that's taking care of Rose, should not be the same physician that's taking care of Sarah. Now,
Correct.
usually doctors will take care of both when
Right.
a donor.
And that's conflict of interest, I feel like.
Absolutely.
Because, you don't know what influence that doctor's going to have on that,
Okay.
the donor child. And I know the donor advocate is is not involved with the recipient at all.
That's an
Right.
independent.
It's independent, and
Okay.
they're solely there for the donor and the family.
Mhm.
So that's a good point. Yeah.
All right.
Now, why do we all understand the bone marrow process? Do we know that because her cells have been affected by the leukemia, they need to be replaced essentially, and the bone marrow that she's going to be getting from Sarah will hopefully give her the stem cells will help her regenerate new bone marrow and hopefully cure her of her disease. Yeah, there are a lot of other reasons that people get bone marrow, things like non-Hodgkin's lymphoma. They can get it also from immune system diseases and metabolic abnormalities. They've actually even considered using it now for heart issues, which is something that I didn't even know
I didn't know
until
that
recently.
either.
Yeah.
I mean, as Bernard says, like this is a new invent in medicine, and many people are getting better on this. So it's a new era, and still will keep us an ethical issue, since because we don't know what's coming. But still, patient side, we need to advocate for a patient, and then a medical field. We also need to work like every criteria is made. And
Absolutely.
we need to advocate and toward for a patient's well-being or rights.
I think that's a good stopping point.
It's a good stopping point.